think it started when I was in high school. That's when I started seeing my dentist on a regular basis. The dentist I went to was extremely clean. I could never smell anything. They were very pleasant, and I thought to myself, I could do this for a living. I would really want to do this. After high school, I went to undergrad. I did 4 years of a biology degree. After the 4 years, I applied to get into dental school. You do have to take what they call the DAT, the Dental Assessment Test. It's an exam to enter dental school. Got into dental school. Basic dentistry for a general practitioner is 4 years of school. Then I did a residency, which is optional. And basically what the residency program is just a little more experience in the real world. And most residency programs are at least affiliated with a hospital. So you not only get the dental portion, you also might get a little bit of the medical portion. So you're treating the whole body, not just the teeth, but the entire body. After the 1-year residency, I came here. It starts off with basically what we call comprehensive dental treatment, meaning the patient comes in, we do a thorough exam on them, discuss what needs to be done, if anything at all. If there's any work that needs to be done that we cannot do here, we refer them out to a specialist. But pretty much we treat everybody. We do have 3 hygienists on staff. They deal with taking the x-rays and doing the clinics. So I pretty much deal with the treatment portion. When I come in the morning, my first patient could be a denture patient, somebody we're making dentures for. My second patient might be an extraction. My third would be a simple filling. My fourth might be a treatment plan, basically where we just sit down, take a look at all the teeth and discuss what needs to be done. The misconception is that the dentist's office is a horrible place where there's always pain and they're always pulling teeth, but dentistry is such a diverse field. There's so many things you can do in dentistry. You can specialize, you can be a general practitioner. You don't even have to practice in the clinic. You could be behind the scenes as a researcher. You could be in Congress, actually, in government, working to improve dental laws. The beautiful thing about dentistry, it's very flexible. Most dentists can actually only work 3 days a week, 4 days a week, and still make enough money to be very comfortable. How much money you make depends on the setting, where you are. Are you in private practice? Are you in a hospital? Are you in a health center? And then again, and what you're doing. Are you just a general practitioner? Are you a specialist? Over here, for me, it's all about the patient. Patient comes first. I'm not in this for the money. I can pretty much do what's best for the patient. I'm an employee. I do not have to burden the responsibility of making money so the practice can keep running, keep going. It's a good setting for me. The beautiful thing is that every day when I see a patient, sometimes it's like a whole brand new experience. I'm learning. Every single day I learn something new, something I was not aware of, a new skill, a new way to use the same instrument. If I keep this up, I feel that, in several years I will have gained so much experience that can take me anywhere. There will always be a need for dentists. When you can seriously see a compliant patient who comes back to you and says, "Doc, I see what you meant about my brushing. I was not brushing properly. Now look at this, I'm clean." I like being able to make a difference in somebody's life.